Hello, everyone, and welcome to I Sell Medicare Plans podcast. Today, I have with me an expert, a real expert in conducting Medicare presentations, Mr. Christian Brindle himself. Thank you, Christian. I'm so sorry. Thank you so much, Christian, for spending a few minutes with me. How are you today?
Hi, Faye. I'm doing great. Thank you for asking. I was flattered that you thought of me when you had this idea. I'm just happy to help and hoping we can bring some value to your audience today.
Well, great. I'm thinking that both our groups and the people who usually look into our groups, there are some people who are new to Medicare. And because we have such a different season this year that's coming up, and we have such a different way that we have to approach doing business, I thought it might be a great idea to just show them a compliant presentation. So I'm going to be your customer. You can call me by Faye or whatever customer name you want to call me, and I'll leave it in your hands. Do your thing.
All right. So let's just say I'm calling you over the phone, and let's say, the scenario here doesn't really matter. Let's say you filled out a lead card, right? Let's say you filled out a lead form or a lead card online. So I would call on the phone. I'd call, you'd pick up. I'd be like, I always start the phone call with enthusiasm and energy. The other thing is I'm always going to want to call the person by their first name. I never want to call them by their last name or Mr. or Mrs. this or that, because they instantly know that you're a solicitor right then and there. If you call them by their first name, they're typically going to be a little bit caught off guard. They're going to be more willing to hear what you have to say because they might think you're somebody that they know. So I'd start out like this. I'd go, I'd ring on the phone. You'd pick up. I'd say, "Hi, is this Faye?"
Yes, this is Faye.
Hi, Faye. My name is Christian. The reason for the call today, Faye, is a while back you filled out a lead card and sent it back into my company requesting information on Medicare changes in your area. Do you mind if I ask you a few questions to determine if I can be of any service?
Okay, I don't recall that, but yes, go ahead.
Oh, no problem. It was in the last couple of weeks. It's easy to kind of, um, you know, forget about something like that. Um, my first question, though, Faye, is basically, are you on Medicare now?
Yes.
Okay. And do you already have a Medicare supplement or some kind of Medicare health plan at the moment that goes with what you have with your Medicare?
To be honest with you, I'm not sure what I have. I just know when I go to the doctor, they're always asking me for all these cards, and
Mm,
I don't pay anything.
I see. I see. So it sounds like you probably have a Medicare supplement by the terminology of that. Typically with Medicare supplements, Faye, the way that they work is Medicare is primary, the supplementary plan is secondary, and they're going to kind of work like a double-edged sword, if you will, to kind of work together to pay your claims. Do you know which insurance company you currently have? You don't have to say an insurance company. You can just say
Uh,
something like that.
I have Aetna.
Okay.
I just got that from work. That's what I had when I was working. So
Oh,
that's
I
what I got.
see. I see. So it sounds like what you have is a retirement program from your employer. Does that sound right?
It probably is because I know that something comes out of my pension check,
Gotcha.
and it's a
Gotcha.
lot of money. So I'm trying to look for some other, just see if there's anything else out there.
Okay, great. Well, do you mind if I ask how much they're taking out of the pension check at the moment? Do you have any idea?
It's $313 a month.
Gotcha. Gotcha. And when you go to the doctor, you're not paying any out of pocket at the moment. You're basically having, for the most part, full medical coverage from what it sounds like. Is that correct?
Correct.
Okay. So basically, what I would say, Faye, is I believe that you can probably potentially find something better, kind of depending on what you're looking for. You can either go the route of a traditional Medicare supplement, which would probably be the most similar to what you have now if you have full medical coverage. Um, and it might be able to be a little bit of a drop in terms of, your monthly premium. The way that a Medicare supplement works is, that you might be familiar with the term of Medigap. The way that that will typically work is Medicare acts as the primary and the supplementary plan acts as a secondary, and you pick those up through private insurance companies. Aetna would be an example of that, United Healthcare, Cigna, Mutual of Omaha, just to kind of name a couple. Do you mind if I ask, Faye, does your retirement plan provide prescription coverage? I assume it probably does.
Yes, I'm sure it does.
Okay. So typically there's kind of two ways that you can go with your Medicare in this regard. You can either go with a Medicare supplement plan, and I believe that you can probably get a little bit of a discount in terms of the premium from what you're paying now, and probably keep the coverage relatively the same. We'd want to check the prescriptions and make sure that they were equivalent. The other way you could go is you could go the route of a Medicare Advantage plan. Everything you ever hear about Medicare kind of falls into one of these two categories in terms of Medicare supplements and Medicare Advantage plans for the most part. And really what's available in the private Medicare market is going to be one of those two programs. The way that Medicare Advantage plans work in comparison is they're essentially going to work as a replacement plan for your Medicare is a nice way to think of it. You're really running your Medicare through a private insurance company. And this private insurance company is basically going to come through and take the place of Medicare. Doctors commonly refer to them as replacement plans. And so essentially the way that those work is since you're running your Medicare through an insurance company, Medicare no longer has to pay 80% of your medical bills any longer, like they're doing currently, I'm sure. That takes a big burden off of Medicare's shoulders, as you can probably imagine. So Medicare agrees to fund this insurance company every month to take care of you. And because they get this funding, typically for Medicare Advantage plans, you typically can get them for very low premiums. In fact, in your market, Faye, you can probably get them for no premium in most cases.
But that's what I'm looking for, because my girlfriend who worked at Aetna as well says that she has a plan and she doesn't pay $300 a month. And she just doesn't have that big out-of-pocket expense. So I didn't know what kind of plan that would be, but I think that I'd like to hear about that.
Yeah, those are definitely incredibly popular, especially in your area. Have you ever seen any of those Joe Namath commercials where he says that I called the Medicare helpline? And have you ever seen that commercial?
Yes.
Well,
and I thought he had retired.
Well, Joe's got to keep himself busy, I guess, right?
Yes.
Those advertisements, the reason why I bring it up is those advertisements and those commercials are advertisements for Medicare Advantage plans. A lot of people don't know that. Essentially, the way that a Medicare Advantage plan will work, are you drawing off Social Security right now, Faye?
Yes.
Okay. So basically, there's a premium that comes out of your Social Security at the moment, typically every month. And that's typically going to be what's known as your Medicare Part B premium. So that premium is $144.60 a month in most cases this year in 2020. But the Medicare Advantage plan won't cost a penny above that. So you just basically keep doing what you're doing now. And a Medicare Advantage plan would basically kind of fit the bill and come in and beef up your coverage. The medical coverage would be 10 times what it would be with Medicare by itself. Now, you wouldn't have full coverage like you're accustomed to, though, with your retirement plan. That's one thing that you got to keep in mind. Typically, with a Medicare Advantage plan, on the medical side of things, you're going to have copays for a lot of things. Like a primary care physician, depending on where you're living, is probably about $5 to $10. Most markets have $0 copays for that, though. A specialist visit might be $30 to $40. An emergency room visit might be about $80 to $90, give or take. If you spend the night in the hospital, you're probably going to spend about $100 to $300 per day in the hospital for the first 5 or 6 days, and they'll pay everything after that. So you're going to have more out of pocket than you're a little bit accustomed to, but it might be worth it, especially if you're healthy, to save that $300+ a month in additional premium you're paying.
That kind of sounds like the plan I had when I was working.
Oh, okay.
I paid a lot less. I paid like $32 every other paycheck. Mm-hmm. And then I had $5 at the doctor's and I don't know, $20 or $30 at the specialist.
Yeah. And probably the reason why it was so much cheaper back then was a lot of times your employer was probably helping subsidize your monthly premiums. And then once you retired, they might have not been doing that anymore. And so you're paying maybe full cost of the retirement program or maybe they weren't subsidizing as much depending on the plan. When with Medicare Advantage plans, they would basically work similarly to that. They do typically come with maximum out of pockets, which are, you could kind of think of those as safety blankets to kind of prevent you from spending too much in a calendar year on medical bills. Um, those safety blankets are probably going to be anywhere between, depending on where you're living, probably a couple thousand to maybe 5,000 or 6,000, depending. We typically will want to look at one that has a lower max out of pocket, some good benefits for you, so that way you're not exposed to too much risk. Typically, Advantage plans are known as all-in-one plans because they'll typically come with your prescription coverage included. They'll come with extra benefits like dental, vision, and hearings, although some programs do more with that than others. And they'll typically come with a lot of extra perks, like, a lot of them will pay for over-the-counter item essentials like aspirin, ibuprofen, fish oil, Band-Aids, vitamins. A lot of them will come with gym membership programs to where they'll pay for a gym membership for you. So that way you can go to the gym and it doesn't cost anything. So there's a lot to like on a plan like this. It comes with a lot of benefits. I have a plan in mind for you. And I'm just gonna wait for a sec.
I'm in
Depending
Utah,
on where.
so
Oh,
it
perfect.
might,
Okay, that makes
you
it
can
easy
tell
for
me
me.
which.
So in Utah, primarily, what I would say is we have a very large hospital system here called Intermountain Healthcare. And the Advantage plans are going to be basically put into two different categories: plans that have Intermountain Healthcare in the network and plans that don't. Do you know where your doctor's located? Do you use the Intermountain Healthcare system?
I think I've heard that name. I haven't been in the hospital, but I think I've heard that, somewhere around about.
I see. Gotcha. So I have a plan in mind. Do you take any medications, Faye, or just a few?
I do. I take the Cinepril
Okay.
for blood pressure and HCTZ.
Gotcha.
Those are the only two I'm taking right now.
Okay, so that shouldn't be a problem. Your prescriptions will be dirt cheap on pretty much any plan we go with. There is, in my opinion, in our market, there's one plan I have in mind for you. There is typically the government has a lot of rules and regulations for us as agents that work with people on Medicare. One of which is there's a form that we typically need to get you to get you to look at and put your autograph on before we actually disclose any benefits for you on any particular plans. They call it a scope of appointment form. It's mainly designed for your protection. It mainly just states that you agree to listen to me talk to you about plans. It basically just says that I didn't, come to your door unannounced and try to, talk to you about plans without any kind of agreement to talk to you ahead of time. I can send that over to you in an email, and you can basically just look it over. It's a very easy DocuSign kind of process. Do you have an email address you have access to?
Yes, I thought I put it on that card, but
Yes,
maybe I didn't. I'll give it to you if you don't have it.
I actually
So
do have
that
it on the
card,
card.
filling out that card doesn't give you permission to tell me about the benefits.
Not for Medicare Advantage plans, not primarily. Not without this particular document, and mainly it's just because it's Medicare Advantage plans are heavily regulated by the federal government, so they have a hoop or two that they make us jump through before we can actually cover them. The only way I can explain it other than that is it's a government form. Like in this country, you can buy a house without needing a form like this. You can buy a car. You can buy almost anything. But for a Medicare plan, they require that they require that they get this form filled out before you can actually talk about any particular benefits. But it's just for your protection. It basically just says that I didn't, come to your door unannounced and talk to you
Okay.
about plans.
Okay.
Would that be okay?
Yes. You can
Okay,
send it over to my email.
perfect. So I'll put that in there right now on the plan that I have in mind. Blah, blah, blah. Okay, so I send it over. You sign it. We'll just fast forward through that.
Okay.
So we got the scope of appointment. So the insurance company that I would particularly recommend for you in our market here in Utah would probably be United Healthcare. Primarily, the reason behind it is they're the largest, most popular company we have here. They have about 60% of the market share. Um, and essentially what they're going to provide you is they're going to give you a very large and inclusive network of hospitals and doctors, which in my opinion, I believe is very important in having choices in terms of where you can go to the hospital. Um, so here in Utah, it's going to give you that Intermountain healthcare system that I was mentioning before. It's going to give you
Okay.
all of the other smaller systems in addition to that. So essentially, they're going to provide you with all of the hospital systems for probably about a 200 or 300 mile radius in every direction from where you're sitting. Um, Now, I want to check your particular doctors and make sure I can find them in the network just to be sure that you can go
Mm-hmm.
there. Even if I'm almost positive that they're in there, we want to make sure and just make sure we're not going to have any problems there. But what I like about this plan is I think they have a real good combination of low copays, fairly good benefits, and they're going to give you that all-inclusive network of hospitals and doctors. Where some of the other carriers, they're going to be much more restrictive in terms of where you can go. And I've always been a big believer, if you have to have a network, you might as well have a big one.
My
um,
my primary care doctor is Dr. James Attenberg.
okay, so let's check for James Attenberg with this particular plan. Um, da, 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 da. Okay, I found him in the network. He's located at 2nd Street in Salt Lake City, something like that.
Yes. Yes.
Okay, perfect. I found him in the network. That should be no problem. Do you see any specialist doctors at the moment?
No, not at
Okay,
the moment.
perfect. And what I like about this plan is if you do need to see some in the future, you're going to be put in a situation where you're going to have a lot of choices on specialists that you can go to. Um, Now, United Healthcare has two versions of this plan. Um, Now, let me ask you this: one of the versions of this plan that they carry is a $0 premium version. It has a referral program. It requires you to get a referral from your primary care physician to see a specialist. Um, and sometimes people can find that to be a bit of a pain in the neck. Does that something that concerns you at all?
I don't think so because I'm pretty sure that's what I had to do when I was at work. I mean, I always, how would I know what doctor to go to anyway? So I probably would
Right.
rely on the primary care doctor's choices.
Right. Yeah. And I feel the same way. You know, like for me personally, if I needed to see a specialty type of doctor, I typically would feel better about getting a recommendation from my primary care doctor anyway. Um, so
Hmm.
I'm completely on board with you there. Um, I think that this plan will work really good for you. It looks like all your doctors in the network, your prescriptions, you can get them for free through the mail order at a 100-day supply. And if you don't want to use the mail order and you want to go to the pharmacy, they typically will cover all the big name pharmacies, and they can give them to you for just a couple bucks every month for a 30-day supply. So it wouldn't cost you much. This would be basically taking your premium down from 350 a month, or what you were paying,
313.
313. This would be taking your
313.
this would take your premium from 313 a month down to zero. The coverage would be not quite what you had with the full coverage, but it'd be still very good coverage. Um, I want to go through quickly these benefits with you, Faye. I'm gonna email this summary of benefits over to you for you to take a look at it if that's okay. And I want to walk
Okay.
through it with you so that way you know what you're getting.
Okay.
Okay,
All
so
right.
then I'll email the plan over. Let's just say you received it and we're both looking at it together. Um,
Okay.
So, Faye, on this particular plan, the way it works is it's a $0 premium. It's got a $5,000 maximum out of pocket. In our particular state, that's the second lowest max out of pocket in Utah. The first lowest is about 4,500, and that plan has a $39 monthly premium. So this is the lowest $0 premium max out of pocket you can find, which is nice. It's got a $0 copay for a primary care visit, so it won't cost you anything to see your
Hmm.
primary doctor. Um, a specialist visit is 40. Preventative services are typically going to be no charge. That's going to be, your physicals, flu shots, vaccines, colonoscopies, pap smears, mammograms, things like that. Um, if you have a colonoscopy and they ever find polyps, though, keep in mind it's a bit of a cost for them to remove those. It turns into an outpatient surgery at that point. Um, but the preventative care is typically not going to cost you anything. If you spend the night in the hospital on this plan, it has a $345 copay per day for days 1 through 5, but that is your entire visit. That's all the doctors you see, all the doctors you don't see, the hospital room, the bed, the walls, the ceiling. It's all included in that cost. Now, there's always a program we can add into that that's known as an indemnity plan that costs about 20, $30 a month, and it can kind of plug in some of the larger copays associated with your plan, including the hospital copay, which is something we can talk about later. Um, and essentially, after day 5 on this particular plan in the hospital, they will pay 100% of your hospital bill if you're still in the hospital for an unlimited amount of days. So you're very well protected in that regard. Um, if you have a same day surgery on this plan, you're probably looking at about $250 out of pocket out the door. Emergency room is going to be $90 anywhere in the world. An Instacare is probably going to be $30 in network, $40 out. This plan has some decent dental, vision, hearing benefits. It has some preventative dental, like cleanings, x-rays, and examinations. What I like about United Healthcare in particular is they have a very interesting exception they'll make on their rider. So they have a dental rider like most Advantage plans do, which basically means you pay an extra 30 to $40 a month in premium, and they'll give you a dental plan in addition to their plan. What I like about United particularly is they'll let you add that rider and take it off any time of the year with no waiting periods. So if you ever needed any additional dental on top of that preventative dental, like if you needed a crown, a bridge, a root canal, that rider costs an extra $35 a month. It gives you $1,000 a year of benefits, and it pays 50% of the major work. The only thing it doesn't pay for the most part, is implants. So keep that in mind. But if you needed a crown, it would pay 50% of the bill up to $1,000 a year. So you could literally add it, get the work done, pay the 1 month of extra premium, get the crown done, and jump right off. So they're incredibly unique by doing that. Most other companies require you to, you can only get on during open enrollment, and you can only get off during open enrollment on those rider plans. The only catch is, if you add the rider, it doesn't take effect until the first of the upcoming month. So just don't wait until the day before an appointment to do it. You got to plan it out a little bit. And they only let you add it and take it off 1 time per year, but that should take care of that dental, vision, hearing side of things for you without having to pay for a plan, really. And this plan has an over-the-counter item benefit. It does $40 every 3 months. So the way that works is they give you a catalog. You can either order online or over the phone or sending in a mailer form. And they give you basically a list of choices for you to pick from. And as long as you stay under your allowance, they'll ship them to you for no charge.
What are those? What are those now? Like, what's an example?
An example of like an over-the-counter item benefit would be like an asprin or ibuprofen.
Oh, okay.
Or
okay.
Vitamins are sometimes going to be on there. Toothpaste. There's a lot of things on there.
Okay.
So that's a kind of a cool benefit. And then this program has a gym membership program with a company United owns called Renew Active. It's a lot like Silver Sneakers, if you've ever heard of that, but it's a little different. Basically, the way that works is they'll pay for a gym membership at a majority of gyms in your area, and we can check your gym and make sure they're in there. But that's basically, in a nutshell, the way this plan works. As you can see in front of you on the summary benefits I sent you, it's a pretty good plan. It's one of the most popular plans we have in the area here. I think it would be good because it'd give you a large amount of hospitals and doctors. It's got good benefits, and I think it's with a good insurance company for the most part. Another thing that I wanted to mention to you, Faye, is my organization really tips our hat on customer service. So once you have a plan with us, you have year-round access to me, myself, and my company. We have a 24-hour return call guarantee. If you ever have a question on a benefit, or if you have a problem with a bill or a claim, you can always call us and get help. I have a 24-hour return call guarantee. If I miss it, I take you to lunch. That's my promise.
Oh, I can't wait.
But don't get your hopes up. I don't do many lunches. I'm real good at getting back.
Oh, my goodness. Oh. Now, my girlfriend also said that, I don't know, she said something about her plan was a 5-star plan. What does that mean?
Well, a 5-star plan basically means in the Medicare world, they typically are given star ratings by the Centers for Medicare and Medicaid Services. And there's a lot of factors that go into what determines their star rating. A lot of it, goes into, how the customers feel like they're treated, the providers feel like how easy the company is to work with, and so on and so forth. And that's basically a star rating. They give them from between 1 stars and 5 stars. The plan that I'm talking to you about is a 4-star plan. Here in Utah, we don't have any 5-star plans, so she must live in another state.
She does. She's in Florida.
Gotcha. And they have a couple 5-star plans down there. A 5-star plan, basically means it's got the highest rating from CMS that it can possibly get. This plan, as you can see on the summary benefits, if you turn the page here, it has a 4 out of 5-star rating, which is very good. And we just don't have any 5-star plans yet, but we might at some point down the road.
Okay.
It's a nice feature in terms of being able to kind of measure how good a plan is, and in the eyes of the Centers for Medicare and Medicaid Services, if you will.
Well, I like the fact that I can save $300 a month. It sounds like, and then I can put some of that money away to cover those copays. Or,
Yeah.
well, I'm just in my head, I'm thinking I can save $300 a month. That means a lot.
Yeah. So basically, we can start the process, if you like, of getting you started on this. Since you're coming off of your work insurance plan, I should be able to get it started for you by the 1st of September. You're going to be granted a special enrollment period for coming off of your work insurance. Do you have your Medicare card handy?
I do.
Okay.
I do.
Well, we can start this process right now. I just got to ask you a couple of questions, and basically that's what I do. That's the end of it.
Okay. Sounds good. You're already in Lean doing an application, right?
Yeah, I was in Lean in the first 10 minutes of the conversation.
Yes, you were, because you sent me the scope of appointment.
Yeah.
So to our audience, you can see that it's the presentation is actually conversational, right?
Yes, and
It's
I,
not
I think it's
just a
very
heavy
simple.
sales pitch. It's conversational. You're giving information, you're educating the customer, and you're letting them know the things that are going to be important to them without overwhelming them. That was great.
Mhm.
Thank you so much.
Well, thank you. I mean, I believe, especially new agents, it's very, very easy to come in and you learned all this stuff, right? And you want to convince the prospect that you know so much. But at the same time, I do believe that you can, like in the sales world, they'll call it you vomit on the person.
Yes,
You
exactly.
overwhelm them with information. You got to tell them what's important. It's not a bad idea to slip in some good helpful information here and there, but you got to make sure that you keep it simple and you stick with them and have them stick with you. And that's, when I was a new agent, I was always trying to overwhelm people, if you will, with my knowledge and make them see how knowledgeable I was. And for some people that would work, but for the most part, it just confuse people. And they might go to around the block and talk to someone who breaks it down much simpler than me. He might not even know as much as me, but he made it more simple. He did a better job at that. And then he might have got the client instead of me.
I think you're right. I probably did that when I first started too, because I just thought could be so impressive.
Mhm.
Because you're right, we have to learn so many things and so many different things, and then we get all these facts and statistics and all of that. And is that really important to the customer at the time you're talking to them? If they ask a specific question, you try to answer it, but I think you cannot vomit on them. You're right.
Yeah.
Don't overwhelm them. If you can make it simple, keep it conversational, then your customer understands. They're going to feel more comfortable working with you. And particularly when you're on the phone, we're on the phone. So this is a phone conversation and you're not looking face to face. We can see each other because it's a Zoom meeting,
Mhm.
but otherwise, when you're on the phone, you got to just stick with the customer and let the customer stick with you. Thank you so much, Christian. Now, some of these things, particularly what a new salesperson should do, are probably contained in your courses that you offer. Can you tell us a little bit about the courses and how to get them?
Yeah, absolutely. I mean, we offer a couple of different programs to agents. And basically, the Dundada course that we put out is the major one. It's called Six Figure Medicare University, and we basically built it to kind of support our Facebook group and YouTube channel, which are both called Six Figure Medicare Agent. And that course at the moment is closing in on about 150 videos of content that were all made by me. And they go over a myriad of different topics. And so we wanted to make it to where if you were a brand new agent coming in and you just were starting from scratch, there's content in there for you. There's content about AHIP and getting E&O and where to look for E&O. And there's, how to get started, how to get good contracts, how to know if you're working with a good upline or something like that. There's sales scripts in there where we talk about, I started early on in my career cold calling. So there's a whole section about cold calling in there and kind of scripts that I used when I was cold calling, from scratch really. And there's advanced stuff as much as, running Facebook advertisements, building brand online, building a YouTube channel, editing videos, technology tools, CRMs, quoters. There's all kinds of great information in there. And every other course we've ever done is also included in there. So we have a TRICARE veterans and federal plan course that I made that is sold separately, but it's also included in that mega course. That's in there. There is a course that we put out in the last couple of weeks or so called my prospecting extravaganza course. And it's a little 10 video course about kind of focused on how to keep your pipeline full at all times and making sure you have plenty of people to talk to. That course is included, but that course is also sold separately as well if someone didn't want to pay for that one. Basically, the Six-Figure Medicare University, we have sales for it from time to time. So sometimes you can get it for $200, $300 or something like that. It's usually $795. But what I would say is anybody that's listening to Faye's podcast today, we'll do it for $300 today if you just use the coupon FAYE, FAYE, all caps.
Great. Oh, what a bargain. What a bargain. And it's particularly now that you've added those other courses that are sold separately, but it's all inclusive. That's great, Christian. That's a wonderful, wonderful deal. So for any of you who are listening and there's additional information that you need or segments that you feel you need to hone in on, take a look at the Six-Figure Medicare Agent University. Thank you so much again, Christian. I really, really appreciate your help.
Well, thank you, Faye. I mean, I was flattered that you asked, and I hope that your listeners can get some kind of value out of it. I mean, I've learned over the years the best presentations are the simple ones. So we try to keep it simple, and I hope that was helpful for people. Kind of see, how to move people down the line.
Thank you. Thank you so much.